Hey everyone, my name is Oliver. I'm working for CBM as a humanitarian coordinator, and today I would like to present at the Ignite stage our lessons learned from a long term intervention on disability inclusive disaster risk reduction in rural communities in Bangladesh. So, the first question that you might ask yourself is, why does this topic matter? So, why is disability inclusion in disaster risk reduction important? It is so because the evidence says so. So, let me just give you two examples. So, we had the Japan, the tsunami and earthquake in Japan in 2011, where the mortality rate among persons with disabilities was 2 to 4 times higher than for persons without disabilities. And also from the cyclone Pam in 2015 in Vanuatu, we've seen that the risk of being injured was more than twice as high for persons with disabilities than it was for persons without disabilities. But even if we do not only look at the mortality and the morbidity side, but look at the participation side. So, what do we see about participation and disaster risk management? There's a wonderful report from the GNDR, which is called The Views from the Frontline, which is from 2019. And there we also have some evidence about to which extent are persons with disabilities involved in disaster risk reduction planning and management. And we see that there's one country example, I don't name the country here, but it says that 82% of people with disabilities and also 97% of women say that they have never been included in any risk governance process. It means they were more or less fully left out. On the other side, we also see that there's positive examples. So in this report, the Philippines is mentioned that 36% of people with disabilities and 30% of women say that they aren't consulted in the preparation of policy plans and action. So we see that the figures for the Philippines is much lower than for the other country here. So we see that there is countries where we have the participation of persons with disabilities and that it is possible. And of course, what we want to see is more cases like we have here in the Philippines. But the example that I would like to present today from our work is looking at Bangladesh, where we have, I would say, also similar success than what you can see here for Philippines. Um, what CBHAM has done, and this is why I think this is such an interesting story here, because we started the whole work in 2009. So we have been involved in disability inclusive disaster risk reduction between 2009 and 2021 in rural communities in Bangladesh. The region is called Gaibandha region. We've been working there with one national partner, which is called CDD, and one local partner, which is really only working in the Gaibandha region, which name is GUK. And you can see here that the project was implemented through 4 phases. So we started in 2009, really like piloting, seeing like, I mean, it was also for CBM the first time that we got involved into disability inclusive disaster risk reduction, seeing like what could be a successful approaches or promising approaches. What we learned from this very first phase then ended in the second phase, where we were about scaling up. So starting only with a few communities or slash villages, then scaling up between 2013 and 2017. Then in the third phase, it was very much about learning from the previous 2 phases and kind of consolidating, doing again more of what we've seen is successful. And then in the last 2 years, we have mostly prepared for the phase out. So having also a clear exit plan, making sure that what we have established over the course of 10 years is also viable and can exist after we have left and do not provide any further funding. Then, of course, when you've been working for more than 10 years in such a context, in kind of the same sector, there's of course a lot of learnings that you can generate from what you have done. And this is what I would like to present today, very much about what have we learned, what is successful factors of disability inclusive disaster risk reduction, what might be also interesting for a replication. Just as a brief background, so the main hazard, as I've also shown on the previous slide, is the flooding. So we have the annual flooding. It also comes along with land erosion. So there's houses literally swapped away. And yeah, we also see the cattle dying, livestock dying. We also see further damage to the crops. So, and this, it happens on an annual basis. It's part of the monsoon rain, but sometimes the water is higher, sometimes it's lower. And if it's higher than the average, then we have the dangerous flooding situation, which might affect people's livestock, their crops, etc. So this is kind of the main hazard that we address to our project, but also cold waves, is common risk in this area. So we were also looking beyond the floods. The overall objective of our work was really to build resilient, but very much also the disability inclusive communities. So making sure that everyone is involved in disaster risk management planning, but also in the implementation. And throughout these 10 to 11 years, we identified 5 key elements of success. And the first one is really about strengthening the leadership of persons with disabilities, specifically through self-help groups, so bringing people with disabilities together in self-help groups so that they can really build up a support mechanism, support each other. But these self-help groups are then also kind of the core for more advocacy work that is steered by the person with disabilities themselves, rather than we as CBM or our partners doing this on behalf of them. Um, the second one is very much about building the inclusive and accessible DRR systems at the community level. So really looking at how do we have to make early warning inclusive, that, for example, a deaf person can also access early warning. If it's only communicated through radio or through a microphone, it's very difficult for a deaf person or a hard hearing person to receive this early warning message. So the second one was very much about building the accessible and inclusive DRR systems at community level. And when we talk about community level, it's also about very simple solutions that the communities can also maintain after we have left. So it's not about high technology, but really looking at what could be easy solutions at the community level that can help people to see their flood coming. Then, of course, the other one was also looking at the established DRM systems, the guidelines, the tools, etc., and advocating to make them more disability inclusive, and ensuring that the government, the local government, is in charge, mostly for the disaster risk management, is understanding how to incorporate disability inclusion in their processes, guidelines, etc. The fourth very successful component was about the DRR awareness through schools. So we've been working a lot with students, including DRR messages in their curriculum. And this was very successful because we could see that students, they have a class on disaster risk reduction. They go home, they tell their parents about what to do when the flood might come in the next days, what is the best way to prepare, what to take with them, what is the most important documents they should take. So seeing that students are very good multipliers, and of course, again, also linking here the disability inclusion lens to whatever we have done. And the last one, which was the most tricky one, I have to say, is about how to make livelihoods more sustainable, more disaster resilient, which is very difficult when you cannot invest huge amounts. But we also have identified a few successful components there. But also, this I have to admit, on this side we also seen some large challenges. So, for example, looking at could group farming work? So where people come together, a few people come together, do farming jointly, which on the one side might be very good in terms of disaster resilience because they could support each other if anyone is struggling. But on the other side, we also see if one or two in this group are very active and three more very passive, then very quick you have these tensions within the group. This was one of the learnings where we've seen sustainable disaster resilient livelihoods. It was the most tricky one. And this is just another quick summary on what we've done. I think it shows this graphic shows it in a very nice way. So really this was at the core of our work, starting with the self-help groups, identifying persons with disabilities. I mean, this is always the most tricky part when you come to these rural areas, finding the persons with disabilities and really empower them that they understand their rights, that they want to join the self-help groups, and that they really want to take up the matter themselves and do not passively wait for someone to help them. So this is really the most important part. And then, as I said, the advocate with the local government is very important. Of course, we also have to look at, when we talked about the early warning, the inclusive early warning, to look at the inclusive and accessible infrastructure. When we think, for example, about a flood shelter, if this is, I don't know, on a hill and the bathroom is only on the second floor, there's only stairs, it's very difficult for a person with physical impairment to use the shelter if they cannot even reach the bathroom. Then, as I mentioned, working with schools was very important, and last but not least, also promoting the sustainable livelihoods. I'm just more or less skipping this one. It's just trying to show how complex the whole thing was. Well, we worked really starting from the individual level, then at the community level, and then more at the local level, which was the local level here, is more the governance structures. But really starting with identifying persons with disabilities, also providing individual support, meaning, for example, providing them with assistive devices, etc. So to bring them in a situation first where they could, for example, join a group meeting. So really working on these three levels and just showing how complex this is and how each of these three levels where we work is influencing each other. Now, I said we've been working there for 10 years. So what is kind of some success stories that we learned? And this is what I call here the success stories, disability inclusive disaster risk reduction structures in action. So first of all, you can see that your work is successful when there is a disaster. And I mean, we cannot stop the disaster itself. The flooding will come every year. Sometimes, as I said, it will be higher. Then we have the worst, the bad flooding situation. But through the disaster risk reduction structures that we have built up, we can, of course, mitigate the impact on people's life. And that is what we have done here. One example is from 2016, where we had a huge flooding. 1,200 households received support through CBM and our local partners. But most importantly, it was not us and not the partners doing the distribution. So we only facilitated, of course, bringing the money in, but it was very much the self-help groups themselves, the self-help groups of persons with disabilities being involved in the assessment, identifying the households of persons with disabilities affected, but also persons without disabilities affected that needed the support. And they even started before we came in, providing food support to 400 most affected households. So we could see that you work with self-help groups and suddenly they drive the process themselves, and all you kind of have to bring in is the money so that they can buy the food and the relief items. They also really organized the whole food distribution process and made sure that it was fully accessible. I think this shows that what we put in place is really taking things up themselves and not waiting for CBM or partners to come in. The other one is also seeing, and I think this is also a success story, seeing like what is the response of the government on what you do. And we've seen that there was a lot of replication and scale up. So first of all, in general, what we have done in Gaibandha has been also taken up at the national level. So the project had a large impact beyond this community or Gaibandha district level. So we see that there's also much more awareness now and prioritization of disability inclusive DRR from the national government, and a lot was learned through this work in Gaibandha. And then we also developed under this project an accessible rescue boat, which is very accessible to persons with disabilities, but also, of course, elderly people, etc. And this we have done one under the project, so one has been constructed, but this has now been taken up by the government, and they have replicated other areas of the country where we have the same risk of flooding. So seeing that the government has really seen like this is successful, what CBM and the two partners are doing, let's do the same and let's do more of it. And last but not least, and this is, I think, more or less an indirect, but still very, very relevant element, which is the access to social welfare. So there is, in Bangladesh, we have a social safety net that is specifically provides support to persons with disabilities. But to get the support, you need to be registered. And of course, some extra money every month can help to make your livestock, your life in general, more disaster resilient. So this is why having access to social welfare is so important. So the first step here was making persons with disabilities aware of this program. And on the other side, also helping the social welfare officers to understand that not each and every disability is visible from the beginning. So that disability has many facets, and persons with disabilities do not all look the same. So helping very much on the one side persons with disabilities getting registered, but also the social welfare officers in the registration process. And within 3 years, we could register a total of more than 450 people, which were not registered before. And this, of course, helped to get this access to the social safety program and helped, of course, to make their life more resilient to disasters. That's it in a very quick summary of what we have done and what we've identified as very promising practices. And I'm happy to share more, bilaterally, with everyone. Thank you again for giving us the space here at the Ignite stage. Thank you. Bye bye.